we ended up in this community following this horse home by actually leading it from the back of a truck just to make sure it got back to the owner's home.
Welcome to Dog Tours Without Borders. I'm your host, Kristen Lair. Today we're stepping outside the classroom and the country, with two of our faculty members making an impact well beyond campus. Doctors Hal Schott and Hayley Gallaher, both specialists at the teaching hospital, bring their expertise to rural Mexican communities, helping people protect the animals that play such a vital role in their lives. Dr. Schott and Gallaher, thanks for joining us.
Thank you for having us.
Yep, thanks for having us.
So to start, I'd like to ask you each to talk a little bit about the programs that you're involved with, what communities they serve, and what types of animals you treat.
Well, we started our program Working Equids in Mexico back in 2017. I've had, over the course of my career, opportunity to work with people around the world and recognized that most of the horses in the world don't get veterinary care. There's estimated to be about 100 million working equids in the world, and probably very few of those ever see a veterinarian, but they're critically important for the livelihoods of the people that own them in rural communities around the world, where these animals continue to work for the families, whether it's carrying crops, carrying water, carrying milk, or carrying people to back and forth as a mode of transportation. So working with people in the United Kingdom initially, I got to meet some people who in Mexico at the University of Mexico City's UNAM campus, as well as the University of Veracruz. And so we collaborate with two veterinary schools in Mexico and veterinary students. And each January, February, we go to Mexico for about 2.5 weeks, and we provide veterinary care in rural communities during that period of time. 1 week spent in the Mexico City area, where we work with our UNAM colleagues and go to a different community each day. And we service anywhere between about 50 up to 150 animals. We provide vaccinations, deworming, castrations, dental work, farrier work, and it is an incredible opportunity for the students to have first round primary care experience. They get a lot of confidence when they work with these animals. The second week we spend in the areas around Veracruz on the eastern coast of Mexico, south of Veracruz. And so we see two different environments. Around Mexico City is high altitude, about 7,000 feet. So we see different conditions. And then Veracruz is the coastal rainforest. And I guess we go there each year with 8 veterinary students, and they are teamed up with veterinary students for the first week from UNAM, and for the second week, veterinary students from UV, and that helps with the language barrier, and they actually get to really become colleagues working, in pairs, working on the animals these 2 weeks.
Great, thank you.
Yeah, so I got involved with the very first year that we went on this trip to the Oaxaca region of Mexico. It was being led at that time by a different professional, Melinda Wilkins, and it was herself, myself, Dr. Donna Harris, and then adjunct faculty, Dr. Jeff Adams, who works with CSNP over on the west side of the state. So we take veterinary students as well as vet nursing students on this trip. And the whole point of our trip is to help the veterinarians in these rural regions of Oaxaca, which is kind of in the southwesterly region, with these spay-neuter campaigns. So the reason that we go to this area is the veterinarians there and that area of Oaxaca have some very, very ecologically important nesting sites for sea turtles. The original veterinarians who founded this, it's been kind of a partnership between a Mexican veterinarian, Marcelino Reyes, and Rich Rogers, who originally founded the Mazunte Project when they were together at UNAM, actually, in Mexico City, quite a few years back. Following that, they decided that there was this need to help control the population. And so what they were seeing is that the dogs and cats in the area were actually predating the eggs and the hatchlings of all the sea turtles. And so the sea turtle population had been somewhat decimated by those animals. So their goal is once a year, and they've started to do more campaigns, but we're involved once a year as we take these students down. We form teams, and there's teams that spread out to all different areas. So there's an MSU team, go green, and we take these students and nursing students and nurses and doctors and perform spays and neuters for free to various communities that tend to be very, very rural. Dr. Pierre Depor, who is a Michigan veterinarian, has been instrumental in getting MSU involved in the Mizunte project. He's been very generous both with his time as well as financially with scholarships for students and supplies and helping us kind of get the lay of the land and figure out how we need to do things. And actually, we've had a few years where kind of immediately following our trip, which takes place in spring 1, they then go and join Dr. Schott for his trip with equine.
That's great. I didn't know we had that many students do that.
Yeah, they get to compare their notes from the first experience to our experience. And
yeah, I'm actually curious what they say about the difference in the two experiences.
Oh, I think they both experiences are extremely positive for the students. And, the good thing is if they're going to get any intestinal disease, they usually have had it before they come join me on the second week. So they can help nurse our students when they get a little GI disease that period of time.
What personally drew you to this work? Did either of you have a moment where you found out about it and said, oh, I have to get involved in that?
So I invited myself on the first trip that I went on. I found out about it from another faculty member that Melinda Wilkins was doing this. I emailed her and I was like, so can I go on this? So I actually have a background in Spanish. So I did a study abroad in undergrad and had always intended to be a cow doc. So I learned Spanish so I could speak to a lot of the people who were working with veterinarians and cows, since a lot of them are Spanish speaking. That didn't end up being what I did professionally, but the Spanish skills have certainly come in handy to be able to communicate with the veterinarians in Mexico, as well as translate quite a bit while we're down there for both the clients that we have come and bring their animals as well as logistically.
So a little bit of a change or different story for me. It's sort of the evolution of my career. I do equine internal medicine and, we do lots of fancy stuff in the hospital, but started to recognize as I was in my late 40s, early 50s, that this is not necessarily the training that our students really need. They really need to see what's out there in practice on the front line. And about the same time, I was like most equine veterinarians, I was relatively unaware of this huge population of working equids around the world. They are a sort of unrecognized partner in, very important partner in rural communities for these families. And so I happened to get to know Professor Derek Nottenbelt at the University of Liverpool. And there's not a person in the world that's probably more passionate than him about servicing these working equids. He's also trained in equine internal medicine, but he spends a lot of time in Africa helping those communities down there. And so after getting to know him there, we actually invited him over here to MSU as a scholar. He gave a college-wide talk about the working equid, and everybody's like, well, what can we do? And he actually introduced me to Mariano Hernandez-Gil at UNAM, and through the American Association of Equine Practitioners, they had a couple of workshops on people interested in trying to develop these programs. So in 2013 and then again in 2016, went on one of these workshops, and then basically on the back of a napkin, Mariano and I developed this program for the following year in 2017, and it has gone on successfully ever since then. And then Dr. Alex Estrada is now at the University of Veracruzana. So there are two people there, but we actually have several veterinarians from Michigan volunteer each year to go on this trip with us. So they're private practitioners that volunteer to take 1 or 2 weeks of their own time at their own expense. And what's really great is to see the students working side by side with these primary care veterinarians, because they start to see what, their real life experiences and that. And so probably have a half a dozen over the years that have joined us. And I have one that Dr. Lauren Fisher, who works with us for both weeks, and she runs the dentistry station, and she will be very upset if I tell her we're not going to go next year. She really looks forward to this trip each year. And, the students get really inspired, I think, also from stepping away from the academic setting and learning from real life veterinarians as well. So these people have been very instrumental in continuing this program for us. And, it's not what I do on a day-to-day basis in the hospital, but it has been extremely rewarding for me to see the professional development of these students. We'll go down there in Mexico and, we're dealing with, again, mostly preventive medicine and helpful medicine, but we'll occasionally get medical problems, and there's nothing more rewarding than having a horse come in with signs of colic. And I look at the students and say, you've got your hands, your brain, a thermometer, a stethoscope, and here's a stomach tube. Go take care of this horse. And they have the deer in the headlights look, and after working with the horse on and off through the day, they'll give it fluids by the stomach tube, and they'll see how it progresses, and actually really say at the end of the day that I fixed that horse. I really did that. And for me personally, in the, towards the later stage of my career, this has been clearly the most rewarding thing I have done, developing these relationships with the people in Mexico, as well as seeing these students grow. Just last year, we did a follow-up survey of the students who have been in the program, both the MSU students and the Mexican students, to see, and they call this one of the highlights of their clinical training here. And many of them say that they learned skills that, they've carried off into practice. And the other thing that many of them have sort of had a light bulb moment is they go to these rural communities, they see the people there, and they realize these people are content without their cell phones going all the time, without all this other things that we're obsessed with all the time. These people don't have much, but they're very content with what they have, and they reflect on their own lives and say, maybe I should think a little bit more like that.
That's fantastic. Something you said just made me think about what is the difference between caring for an equid, whether it's a horse or a mule or a donkey, that a family relies on for their livelihood?
There are a few differences, and it's interesting because you work with these people, and in some communities you can see that animal-human bond is stronger than in others. Simply one way to see that is you ask them the name of their horse, and they just say horse or mule, right? It doesn't actually have a name. Get to another community, and many of the animals actually are named. And what the AAP, when some of their workshops have tried to really also add, we've not been able to really do that, is actually to have educational programs for kids in the communities where they have, talk about the human animal bond. The idea being that if you can train the younger ones to be a bit more in contact with their animal, that will spread as they grow up and stuff like that. So the animals in generally are in pretty good shape. They're pretty well cared for, but what they don't have is just some basic knowledge of what the animals might need. So we try to do a little bit of education there. Each year, we probably go back to 3 or 4 communities that we've been to before, and we see 5 or 6 new communities because there's a lot of demand for our care. We have seen in the communities that we repeatedly go to that there have been some improvements overall in the health of those animals and their overall management.
It's interesting because you talk about companion animals versus working animals. And I would say that certainly to some degree on the Mazunte trip, we're treating people's pets. But a lot of those animals are not just pets. The cats and dogs. Cats have jobs. They kill rats. They kill mice. The mice and rats carry disease. That's why they have the cats. The dogs guard their houses. It is a different experience treating animals in another culture than it is here. And again, not everywhere in the U.S., because I would say there are some places in the U.S. where it is very similar. Maybe not here in East Lansing, but other places where animals that are considered companion animals are, in fact, working animals.
It's a good perspective. I hadn't thought of that. So one of the things that you both brought up is you're doing this care for these animals in rural environments, but you're not in a clinic. You're often outside in a field, under an awning, under a palm tree. Tell me a little bit about how that care that you're delivering differs from what it would be like in a clinic.
You have to be creative a lot of times. Very common for the working equids. We'll work in a community soccer field, so a central area in the town. So we do at least have a nice sort of semi-flat area with grass. Hopefully we look for the best shade for the farrier to work under and the surgeons to work under. And we still try to practice good surgical techniques and be as aseptic as possible and do things. But again, there's things blowing and things like that. And you realize that, sometimes it's only 95% of what you want to do, but it still gets the job done. And there's a lot of creativity on the moment. A problem you didn't recognize, you might not have the right tool. We try to improvise with whatever we can find in the community. So it is a little bit different. But again, I think veterinary medicine, a lot of the root is still problem solving. And so this is putting them on the front line sometimes of problem solving, right, in action. So, and again, that's one of the things when they solve a problem like that, you can see the confidence of the students just really increase exponentially.
One of the things that I think is special, about the Mazunte trip is we advertise it and are very strong proponents of it being a student-led trip. So the students are in charge of organizing. The nursing students are in charge of calculating all the drugs and pulling up everything. The students decide who's going to do which surgery. And if things aren't working, they're brainstorming to come up with that. They figure out how many animals we're going to be able to do surgery on and offer our services to that day. And the amount of confidence that we see in those students as they realize they are the doctors, they are the nurses, they are the advocates for the patients grows exponentially in that.
So I was wondering if you could each share a moment, something that pops into your head, whether it's a particular case or a really interesting day that you had on any one of your various trips, if you could tell us a bit about it.
I think I sort of mentioned already, like when we get the challenge of here's something we didn't expect today. And instead of me going over and trying to solve the problem, I turn the problem over to the students and say, you've got some tools, you've got some resources, you've got some problem solving skills. Go to that horse, see what you can figure out. And then if you have questions, come back and I'll help. But I try not to hover over them too much to make them actually solve these problems. And again, it starts off the first couple of days, the deer in the headlights is very real. And by the end of the second week, these students are really organized. And as Dr. Gallaher said, I also have students sort of run the program. So they develop teams before we go, and they sort of have a rotation. Okay, who's going to be doing surgery today? Who's going to be doing anesthesia today? Who's going to be concentrating on farrier? Who's going to be concentrating on dental work? And then some days we get a lot of surgery, some days we get less, and they go back at the end of the day and start to compare, say, okay, who's done what and whatever, to try to balance that all out. But we really try to make the students run that type of the program and be in charge of it as well.
Great.
So we had 2 complications happen this last year. One was surgical and one was anesthetic. But I really feel like the students learned so much from both of those situations that they might not have gotten the chance to do otherwise. Where, a surgical error happened, we had to switch gears and do a different procedure on top of just the spay, which ended up in the patient having a larger incision. And we had to think about, okay, so we have 4 drugs that we can use here. None of them are great pain medications. And because of the surgery that we had to do, we couldn't use one of our drugs. We couldn't use an NSAID for pain medication for this patient after surgery. So I was like, okay, well, here's what we have. I'm listing through our drugs. And ultimately we had to come up with this, field plan of like, hey, we're going to inject bupivacaine into the abdomen. And so that was actually a really interesting experience. Something that I had done here in the clinic for like severe pancreatitis, but we actually met that family every single day for 4 days at a truck stop. And just to be clear, this is like a dusty roadside where cars just kind of slow down as they go around the corner. And we brought a nurse, we brought the student with us, and then we would kind of do a sterile prep and inject the bupivacaine. And that family was so grateful. Like, in spite of the complication, they were so grateful for the care that we were showing their animal. So that was an interesting one for me, is doing a resection anastomosis underneath a soccer field in Mexico. So that was an interesting. And then likewise, our anesthetic complication that we had, it was a mistake. We're working with students, we're people, we make mistakes sometimes. And so that was a little bit more kind of playing detective, trying to figure out what exactly had gone wrong. When we realized what had happened, I actually reached out to one of our anesthesiologists here, Dr. Debbie Wilson, who thankfully answered my phone call on a Saturday, I think. And we kind of figured out, okay, well, this is what's going to kind of keep happening to this animal, so we can keep track of and keep giving them a reversal agent for the overdose that they had gotten. And the students were great. We ended up taking the animals back with us to the hotel, and they were with us for almost 48 hours. The students figured out a schedule, so we watched them around the clock to make sure that they were not kind of redosing themselves because of the long action of the original drug that they were given in an overdose. And it was 2 kittens, 2 spays. Those kittens went home to their owners. So, we were really lucky, but I feel like as a group, we learned so much from that situation, all the students who were involved, including the nursing and veterinary students. And I learned from them too, how do you handle when you have a complication like this? What do you do to communicate to the owners what's happened? How do you reach out to your resources to try and figure out, okay, what is this going to look like? What are we going to do? And then working as a team to try and get the best outcome possible for your patient.
I'm going to back up and ask a question that I didn't think of
ahead.
to clarify. So both of you have talked about anesthesia, but we're not talking about the same type of anesthesia that we do in a surgical theater here, correct?
at least for us, correct. I mean, ours are all intravenous medications where students calculate the doses, they administer the medications. And I was going to sort of follow up with that always doesn't go perfectly well. So we'll do somewhere between 50 and 70 castrations each year. Now, these are young animals. They're not always that well broke, so they're excited sometimes when you give them medications. And we had one a couple of years ago that woke up a little bit early. The surgery was completed, but it was not ready to stand. And it did cartwheels and circles around other surgical fields that were going on. And so we had to resedate this horse several times. And actually, we ended up in this community following this horse home by actually leading it from the back of a truck just to make sure it got back to the owner's home okay. But it was quite eye-opening for the students to see that. And then last year, we had a weanling come in, and these are often they'll haul them in sometimes in the back of cattle type trucks. And so there was a mare and about a 4-month-old weanling in there, and they opened the gate, and the weanling was down and actually had injured itself. It actually had an open fracture of its lower hind limb, and it's laying there. And so I said to the students, what are we going to do? And so we were able to give it some sedation. And then the student performed a Atlanto-occipital CSF tap, and we used lidocaine intrathecally for euthanasia. And it went very, very smoothly. But, that was a situation that we don't have, obviously, euthanasia solutions down there for that. But we had to be creative and think on the feet. And the student I know will remember that experience for the rest of her life.
And so the humane euthanasia was necessary because in this rural environment, that type of a break would not be something the animal could recover from, correct?
Yeah, correct. Yeah. And that even if the animal was presented here, that would have been an injury we would have recommended euthanasia for. It was non-reparable.
Okay, thank you. So that actually feeds into my next question, which was, do you remember a particular student who was really transformed by this experience?
One of my students this year was one of the leaders of the project, and she was very organized and things like that, but she was a bit timid. And what was very interesting is she was doing quite a good job down there, but on the second or third day of the clerkships, the students found out about their NAVLE scores, and 2 of the students didn't pass. And so that really set them back, and this student was one of those. And it hit her pretty hard for a day. And she thought, I'm just not going to be able to do this. I'm not going to be successful. And so we just spent a little bit more time talking with her. And one of the other veterinarians that was on the trip with us from private practice was one of her private practice mentors. And we both just told her, you are really good. You can do this. And she regained the confidence and did really well. And then very interestingly, the person that she decided to go to work with after graduation, just last year, brought in one of her own horses earlier just this week to the clinic here. And she said, whatever you did to train that student, keep doing it. She said one of the best students she's ever hired as a veterinarian. So, it just goes to show that sometimes with failures can build on that and become even better successes. So I do think this student, I knew she was going to be a good veterinarian. I told her that from the get-go the whole time. And it just took a while for her to regain her confidence, but she's doing great.
That's a great story. Thank you.
There was one student that we had, not this last year, but the year before, who had actually started out as a vet nurse, gone to vet school here. And I think she actually also went on the equine trip too. But she was actually relatively quiet at the beginning of our trip. And there wasn't really like a kind of leader that had emerged amongst that group. And at some point, Dr. Harris or myself, I can't remember which of us, had kind of pulled her aside and just kind of encouraged her to like step up and take leadership, because the other students were responding her, and man, she really responded. And she started taking charge, kind of helping direct how operations were going to go. And it was one of the most magical leadership transformations that I have personally seen. So that was really cool to watch, and amazing too to kind of see her be able to then use that to kind of harness the power of the group and motivate people and organize everything.
How do you think this kind of work broadens what it means to be a veterinarian in today's world?
Oh, I think this trip is an eye-opening experience. So, dealing with group of students who are still relatively young. Many of them have never been out of the United States before, so it's a first international experience they've had. And again, I'll go back to what I said earlier. I think they recognize that there's some benefits of the simple life, getting away from social media and their phones and things like that, seeing how content these people are in their rural environments with what they have. And so they, I think maybe reassess a little bit more about what is truly important in life. At least I hope they're thinking about that a little bit. And hopefully that has a longer lasting impact on that. So one of the things we did with the follow-up survey that we did with the students this past year and say, how many of you continued to either volunteer some way in terms of, providing veterinary care in some type of situation. And actually the vast majority had continued to do some, even early stages of their careers, because they've only been out, 5 years or less, most of them.
So a few years back, we had a group who fell in love with their experience in Mazunte to the point where at the end of the trip, they all got matching tattoos of sea turtles. But from that group, 2 or 3 of them, I want to say, have come back multiple times now to do as like volunteer veterinarians on other teams. And we talked about kind of gaining that service mindset, and it's just really cool to see students have that shift and then realize, hey, this is something I want to do for the rest of my life, is serve others.
Yeah. I should follow up. One of our veterinarians that now goes on the trip actually was one of our students that had experienced the clerkship as well. And she, comes back and she's a really, really positive influence on the students.
That's great. Why do you believe programs like this are essential? Not just as electives or extra experiences, but as part of a core education for future veterinarians?
I can jump in there again. We're getting out of the hospital. We're on the front lines. We're doing primary care. They're learning to problem solve with limited resources, limited tools. And then secondarily, I really think that in addition to this being a veterinary experience, it is truly a cultural experience. I've talked about their interactions with the communities, but we also want them to see the culture of Mexico a little bit. So when we're in Mexico City on the Sunday, we'll go down to what's known as the Central Square or Zocalo, and we'll tour the Aztec Pyramid Museum, and they'll see a bit of the culture as well. And then when we're in Veracruz, they'll also visit the fort there that then was a prison in the harbor and learn a little bit about Spanish history or Mexican history as well. So I do want them to also appreciate that it is a different culture, because I know the very first time I traveled internationally, I opened my eyes that the U.S. is not necessarily the center of the world. Other people in other countries have a pretty high opinion of their own countries and want to share that culture and share what they have.
Thank you.
So when I was a vet student, I did I'm going to say analogous, but not the same, program that went to Native American reservations in the U.S. And we did similar free clinics on those reservations. And I started doing those before vet school and then continued them through vet school. And I remember thinking that was really where I learned how to be a doctor. Think on your feet, problem solve. If you don't have all the resources you think you'd like, figure out another way of doing it. And I just feel like that, in addition to providing that multicultural experience, that they may not have had that experience in undergrad, or maybe they haven't even had the chance to travel internationally before. And now they're having a way to do it and serve other communities. And on top of that, I just think that's in our changing society, it's so important to underline and emphasize the similarities that we see in other countries, as well as celebrate the differences between our different societies and really learn to appreciate some of those differences too.
What do you hope that students, and particularly our listeners, take away from hearing about this type of work?
Well, one, I'd really hope that they just want to do it. Get involved. Say yes. Like, so many times you have these opportunities, and if you just say yes or try, you're going to have such a rewarding experience. And I hope that it inspires people to get involved and give back to either their community or other communities and get something out of that.
Yeah, I think I would agree with that completely. Just doing something out of your comfort zone and trying something new like this. And I think, other very rewarding part of this is just to see how appreciative these animal owners in Mexico are of the services we provide.
Absolutely.
One of the highlights of the trip for me and for the students as well over time is we often get fed at the end of the day, and we get truly very good Mexican food that comes in big pots of chicken or pork or things like that, and all this homemade stuff. It's not what you're going to find in a typical Mexican restaurant, and it is very good, but you see how appreciative the communities are. Occasionally, they even invite us into their homes for these meals, which is really rewarding. So, I guess that for people listening, I hope this maybe makes you aware of the vast need there is for providing veterinary care to communities around the world. Encourage you to try it, get involved, and there's many ways to get involved. You could also help by sponsoring a student, sponsoring our projects, because I could not have done this earlier in my career, because the way I've actually supported this program is through a lot of contacts I've made in pharmaceutical industry to get them to donate the vaccines and the supplies that we need. And they do that each year. And then at the same time, I sort of twist the arms of clients that come through the hospital that have had a hopefully positive experience and say, hey, look, we really need support of these veterinarians. And so our program is run on a lot of private donations that help sustain this. So what we try to do is make this program affordable for students so they can actually get a travel grant through our international programs in the College of Vet Med. So that covers typically their airfare and a little bit of spending money. And then through the donations, we are able to pay for all the lodging, all the meals, all the transportation for the students in Mexico. So it doesn't cost them any additional funds to go on these experiences, and that makes it open. So it's not a privileged student experience only. Any student that is qualified can get on this trip.
That's great. Thank you, Dr. Schott and Gallaher, for a look at how veterinary medicine extends its impact into communities, classrooms, and across borders. Thank you for joining us. We look forward to bringing you more stories next time.
Adios.
Adios.